Which of the following is the primary purpose of enzymatic detergents in decontamination? A. Lubrication of instruments. B. Breakdown of organic debris. C. Disinfection of biofilm. D. Corrosion prevention. Answer, B. Enzymatic detergents target proteins, lipids, and carbohydrates to dissolve organic material before sterilization. Lubrication and corrosion prevention occur in later stages. When testing a steam sterilizer's vacuum system, which test ensures air removal from the chamber? A. Bowie-Dick test. B. Biological indicator test. C. Helix test. D. Dart test. Answer, A. The Bowie-Dick test evaluates vacuum-assisted steam sterilizers' ability to remove air, which is critical for steam penetration. Biological indicators test microbial kill, not air removal. A lumen laparoscopic instrument arrives in decontamination with visible debris. Which action is required? A. Immediate sterilization to prevent contamination spread. B. Manual brushing with a neutral pH detergent. C. Soaking in glutaraldehyde for 2 hours. D. Processing in an ultrasonic cleaner without disassembly. Answer, B. Lumen devices must be manually cleaned with brushes and detergent before automated cleaning to ensure debris removal. Sterilization cannot occur until cleaning is complete. Which sterilization method is most effective for heat-sensitive endoscopes? A. Steam sterilization at 132 degrees Celsius. B. Hydrogen peroxide plasma. C. Peracetic acid immersion. D. Ethylene oxide, ETO. Answer, C. Peracetic acid, e.g., Steris System 1, is the gold standard for endoscopes due to rapid low-temperature sterilization. ETO is effective but requires aeration. Which of the following is a critical parameter for ethylene oxide sterilization? A. Relative humidity greater than or equal to 40%. B. Pressure of 15 psi. C. Temperature of 121 degrees Celsius. D. Exposure time of 5 minutes. Answer, A. ETO sterilization requires 40 to 80% humidity to penetrate microbial cell walls. Temperature and pressure are lower than steam sterilization. During instrument inspection, a pair of scissors shows staining but functions properly. What is the next step? A. Reprocess with enzymatic detergent. B. Pass for sterilization as is. C. Quarantine for rust removal. D. Discard immediately. Answer, A. If scissors show only staining and work properly, clean them again with enzymatic detergent to remove the residue before further use. Which packaging material is contraindicated for hydrogen peroxide plasma sterilization? A. Tyvek pouches. B. Paper plastic pouches. C. Nylon sleeves. D. Cellulose-containing wraps. Answer, D. Cellulose, paper, absorbs hydrogen peroxide, preventing sterilization. Tyvek and polypropylene are compatible. Which of the following is the minimum exposure time for gravity displacement steam sterilization at 132 degrees Celsius? A. 3 minutes. B. 10 minutes. C. 15 minutes. D. 30 minutes. Answer, C. The minimum exposure time for gravity displacement steam sterilization at 132 degrees Celsius is 15 minutes for wrapped instruments to ensure effective sterilization. A rigid container's filter integrity is compromised. Which action is required? A. Replace the filter and reprocess the container. B. Sterilize the container twice. C. Use the container for non-critical items only. D. Seal the filter with autoclave tape. Answer, A. A compromised filter renders the container non-sterile. Filters must be replaced per manufacturer guidelines. Which of the following is a key advantage of flash sterilization? A. Reduced aeration time. B. Suitable for implantable devices. C. Rapid turnaround for emergency use. D. Eliminates the need for cleaning. Answer, C. Flash sterilization provides quick processing, 3 to 10 minutes, but is only for emergencies due to higher failure risks. Implants require full-cycle sterilization. Which test verifies sterilizer chamber leaks in pre-vacuum steam sterilizers? A. Bowie-Dick test. B. Air removal test. C. Vacuum leak rate test. D. Biological indicator test. Answer, C. The vacuum leak rate test checks the sterilizer's ability to maintain vacuum, ensuring air removal efficiency. Which instrument classification includes vaginal speculums? A. Critical. B. Semi-critical. C. Non-critical. D. Environmental. Answer, B. Vaginal speculums contact mucous membranes but do not penetrate sterile tissue, classifying them as semi-critical. Which of the following is the primary risk of using instrument lubricants after cleaning? A. Reduced steam penetration. B. Microbial contamination. C. Corrosion acceleration. D. Residue buildup in lumens. Answer, A. Lubricants create a barrier that blocks steam contact with instruments, leading to sterilization failures. Which of the following is required for proper ultrasonic cleaner operation? A. Fully submerged instruments. B. Aluminum trays. C. Enzymatic detergent. D. 90 degrees Celsius water temperature. Answer, A. Instruments must be fully submerged for cavitation bubbles to clean effectively. Aluminum trays interfere with ultrasonic waves. Which of the following is the correct load configuration for steam sterilization? A. Paper plastic pouches placed flat on shelves. B. Metal trays stacked vertically. C. Rigid containers placed on their sides. D. Textile packs placed tightly together. Answer, A. Pouches must lie flat to allow steam penetration. Stacking or vertical placement traps air. Which sterilization monitoring method provides the most reliable evidence of sterility? A. Chemical indicators. B. Biological indicators. C. Bowie-Dick tests. D. Parametric monitoring. Answer, B. Biological indicators, spore tests, directly measure microbial kill, the gold standard for sterility assurance. Which of the following is the first step in processing a contaminated flexible endoscope? A. Leak testing. B. Manual cleaning. C. High-level disinfection. D. Automated flushing. Answer, A. Leak testing prevents fluid intrusion during cleaning, which could damage the endoscope. Which of the following is a critical flaw in instrument inspection? A. Slight discoloration. B. A burr on a scalpel blade. C. Minor rust spots. D. Water spots. Answer, B. A burr on a blade can compromise surgical precision and patient safety, requiring repair/replacement. Which of the following is the primary purpose of aeration after ethylene oxide sterilization? A. Cool instruments. B. Remove toxic residues. C. Dry moisture. D. Activate chemical indicators. Answer, B. Aeration removes residual ETO, which is carcinogenic. Standard aeration times are 8 to 12 hours at 50 to 60 degrees Celsius. Which of the following is an FDA-cleared method for monitoring low-temperature sterilization cycles? A. Class 1 process indicators. B. Class 5 integrating indicators. C. Class 3 Bowie-Dick tests. D. Class 6 emulating indicators. Answer, D. Class 6 indicators are designed for specific low-temperature cycles, e.g., hydrogen peroxide, peracetic acid. Which of the following is the maximum storage time for a sterile pack in a closed cabinet? A. 7 days. B. 30 days. C. 6 months. D. Event-related, no expiration. Answer, D. Event-related sterility means packs remain sterile until compromised, e.g., torn, wet. Time alone does not invalidate sterility. Which of the following is the primary risk of overloading a sterilizer? A. Extended dry time. B. Inadequate air removal. C. Chemical indicator failure. D. Packaging tears. Answer, B. Overloading traps air, preventing steam contact with all surfaces. This is the #1 cause of sterilization failures. Which of the following is required for proper high-level disinfection? A. 20-minute immersion time. B. FDA-cleared chemical. C. Sterile water rinse. D. Biological monitoring. Answer, B. Only FDA-cleared chemicals, e.g., glutaraldehyde, OPA, are validated for high-level disinfection. Which of the following is the correct water quality for final rinse in automated endoscope reprocessors? A. Tap water. B. Filtered water. C. Sterile water. D. Distilled water. Answer, C. Sterile water prevents recontamination during the final rinse of semi-critical devices like endoscopes. Which of the following is the primary purpose of a tray liner in sterilization packaging? A. Absorb condensation. B. Enhance steam penetration. C. Prevent instrument movement. D. Provide a sterile barrier. Answer, A. Liners absorb moisture during sterilization, preventing wet packs that compromise sterility.